I think that there are some particular difficulties that women do face, and that's, you know, there is still this question mark that many people have when they're recruiting. It is, if it's a woman, is she going to go and have a baby and leave? And it's not said, but people often think that. And there's not really anything you can do about that if you're the person being interviewed, except you do then have to carry anything else you have as a positive forward, so that that kind of subconscious, potentially subconscious prejudice is kind of wowed away, you know. But that's a real thing. I think that really does exist. I think as an employer, I employ a lot of women. Loads of people in my group have had babies, and if you have children, you always have occasions when something happens. But the job we do, unless it's a critical experiment that has to be done that day, you're judged in what you do in a year, not what you do in a day. And in fact, with REF, you're judged in what you do in 8 years, you know. So, okay, something might crop up and you have to, in an emergency, you know, just not come in or, you know, not do that thing. But you've got, you know, time to make up for that, and the job is very flexible in that respect. So I think don't put stuff off for your career, because, you know, it's a marathon, not a sprint. I think where you have a negative happen to you in your career, which happens to men and women, papers rejected, grants rejected, your perception that someone hasn't treated you equally or fairly, you have to really turn that into a passion. You have to turn it round. You have to get that feeling of, you know, that feeling in your gut of disappointment, and you have to then channel it into thinking about your research and maybe improving the grant, or you're trying things another way. So you have to be very persistent, you have to be very determined, and I think you really do have to handle that rejection.